Hi, everyone. My name is Jared Bartel. I'm a neurologist and headache specialist at the University of Utah. I work at the Salt Lake City VA, where I'm the Headache Center of Excellence Director. I'm also the director of the Headache School. And I'd like to introduce Dawn Buse, PhD, who's a licensed psychologist and clinical professor of neurology at Albert Einstein College of Medicine, and a member of the board of directors of the Headache Cooperative of the Pacific, and a past member of the board of directors of the American Headache Society. She has worked with people with migraine and other chronic painful conditions for more than 2 decades through clinical care, including biofeedback, cognitive behavioral therapy, and relaxation training, cognitive, and research and patient advocacy as well. She has more than 200 scientific publications and has won 10 US and international research awards and 4 professional awards for her work in the field of migraine. She's been co-investigator of the American Migraine Prevalence and Prevention Study, the Chronic Migraine Epidemiology and Outcome Study, the Migraine Signature Study, the International Burden of Migraine Study, and Symptoms and Treatment in America Study. She offers free guided visual imagery and relaxation exercise for pain management at dawnbuse.com. And with that, I'd like to turn it over to Dawn Buse.
Thank you, Dr. Bartel. Thank you so much to University of Utah Headache Center for having me, and hello to the Headache Center of Excellence at Salt Lake City. I'm a big fan of the Headache Centers of Excellence of the VA, and of course, I'm a big fan of the U because that's where I got my PhD. So I'm just happy to see everyone today. This is a great topic near and dear to my heart. We are calling it officially Behavioral Management of Migraine, but as you know, we went back and forth on some subtitles like, why the heck am I being referred for this? I'm not crazy. Why do I have to see a psychologist? Those are all of our subtitles. So let me spend some time answering all those questions. As in my kind introduction said, I am a psychologist. I'm also a researcher, so I get to talk to people one-on-one in the lovely privacy of our office. I also get to do surveys where we survey, literally for the Overcome study, 60,000 people living with migraine. And I'm always amazed by how much the results really line up, that humans are humans and this is a tough disease to live with. So with no further ado, here are my disclosures, meaning that these are companies with whom I've consulted, who've supported my research, places that I have received grant support, including the US FDA, the National Headache Foundation, and I'm also a part-time employee at Vector Psychometrics, where we're doing the FDA grant called Measuring What Matters, where we are getting input from people living with migraine as to what the FDA should measure in their clinical trial endpoints to say that a treatment does or doesn't work. So it's a great project we're working on. All right, let's just admit, life with migraine is not easy. This is a chronic disease. It may start in childhood, adolescence, young adulthood, and may linger as part of your life for decades or forever. And so it's really a marathon, not a sprint. We talk a lot about management, and we're going to talk about management today. This disease steals away moments. It steals away accomplishments. It steals away time. It strikes without warning. Headache, migraine attacks come whenever they feel like it, leave whenever they feel like it. And living with something that's insidious, painful, but debilitating, that strikes without warning, is just a hard way to live. We know from research, and we know one-on-one, that people have a lot of feelings about migraine, as they should, rightfully so. You may feel really frustrated that you have to live with this. You may feel angry at things that is taken away. You may feel guilty when you can't be the parent or the partner or the employee or the student that you want to be. These are all very valid feelings. In fact, in the My Migraine Voice, which was conducted in 2018 with people with 4 or more migraine days per month from many countries around the world, we found that about half of people said, people don't understand my migraine. They don't understand how disabling it is. They don't understand how painful it is. I feel depressed. I hate my life because of migraine. I feel helpless and I don't have control. These are very common feelings. These feelings are different from what I'm going to talk about, which are comorbidities. Comorbidities mean that some conditions occur more often than by chance for people with migraine. Those are going to be things like depression, anxiety, but also respiratory illnesses like asthma and cardiac incidents, as well as sleep illnesses. All sorts of things kind of co-occur together. I'm going to talk about the feelings, talk about the comorbidities, talk about what we do about all of them. So, you know it, I know it, we all know that migraine is disabling, but the World Health Organization actually knows it too. And in their most recent survey of every disease on the planet, for every 7.7 billion people living on the planet, what is most disabling? Well, migraine is second most disabling. When you multiply the amount of disability caused by the amount of people, you get these years lived with disability. Migraine is the second most disabling disease on the planet. And among women age 15 to 49, it's actually number one, followed by back pain and depression. So there's no question anymore. There was a question decades ago, is migraine really disabling? Is it really that painful? Is it really that much of a problem? That question's been put to bed. The answer is yes, this is a disabling disease. Okay, but how do we manage it? Let me talk a little bit about some of the specifics. You already know this if you live with migraine or have a loved one who lived with migraine, but from our CAMEO study, the Chronic Migraine Epidemiology and Outcome Study, migraine can impact every aspect of your financial life, your career, your academic achievement. That impact increases as your number of monthly headache days increases. This is very logical. If you have headache on 20 days a month, or let's say on average 5 days a week, this is ridiculous. How can you function? Yet we see this impact start with 1 or 2, 3 or 4 headache days per month. And some people may say, oh, that seems kind of low. But then again, talk to any person out there in the world and say, I'm just going to randomly steal away one of your days next week. You don't know. Is it going to be Monday? Is it going to be Friday? You don't know. It's going to come like that. You're not going to be able to work. You're not going to be able to take care of your family. You're going to feel terrible. And it's going to happen once a week. So just look out for that. Well, when you put it that way, 4 monthly migraine days is pretty disabling. We see that in the data. We see that in the finances. We see that in the academic achievement, people choosing to go on to additional education, people choosing to take career paths that might require more time or energy or travel or be more rigorous, choosing to make other life decisions. In fact, we also find that migraine significantly impacts people's perception of how good of a parent they are, how good of a spouse or partner they are. And in fact, in studies around the world, not only in USA, in 2 different studies and in European countries, we found that people with migraine have chosen to have fewer children, delay having children, or not having children because of their worry about, can they be a good enough parent with migraine? What might they pass on to their children in terms of the genetics of migraine? And the difficulties of stopping medication treatments during pregnancy or pregnancy trying or postpartum. So this is a very disabling, potentially disease. Also, if you're someone who lives with migraine or has a loved one with migraine, you're going to know that kind of like you throw a rock into a pond, it does not affect only the person with migraine. There are ripples, there are concentric circles. Migraine can affect everyone in the immediate family, everyone who lives in the household, caring for kids, getting them dressed, driving them to school, time with a partner or a spouse, or even finding a partner or a spouse, dating, relationships. There's a fair number of people who will say that the disruption of migraine led to so serious impacts in their relationship that it led to divorce, or it led to needing to see a couples counselor and work on the marriage. It can put imbalances in relationships. So it starts to feel that one person's more of the caregiver and one more person's more of the caregivee, instead of that kind of balanced relationship that is more optimal in long term in relationships. So I'm throwing out a lot of negative things. I'm sorry, I hate to start with this, but I want to throw out a lot of scenarios where a psychologist, a mental health provider, a behavioral therapist is going to be helpful. That's just one side of what they can do. Let's jump into our therapies. See if I can move on. Here we go. All right. When you get to see a headache expert, a headache center, or if you're just learning on your own about what are the full kind of armamentarium of therapies we have today. This is everything that the experts, the American Headache Society, the American Academy of Neurology, talk about and think about. And we want to pull from these validated, guideline approved, FDA approved approaches to create a personalized, tailored approach for you. So one of the circles is going to be education and lifestyle. This is a little bit of a hard one. I'm going to talk about a little bit what matters. It's not a long list. It's about half a dozen things that actually really do matter in managing migraine. Behavioral. I'm going to spend some time on the behavioral therapies. What you would do if you came into my office, what you can do on your own with an app, with a wearable. Pharmacologic, that means medicine. Our medicines fall into two types. As you know, acute, you take at the time of migraine or headache. Preventive, you take on a regular basis to avoid, have fewer, have shorter, have less disabling attacks. Prevention may be a pill you take by mouth orally. It may be an injection you give yourself once a month. It could be a injection that you receive at a hospital or a center once a quarter. So we've got some preventive medication options. The behavioral are preventive behavioral options, meaning you do them in advance to try to reduce your number of attacks, reduce the attacks from happening altogether. And that's ideal. That's what we all want. We'd rather not have an attack at all than have to treat it. But prevention and acute really work together. Neuromodulation. Neuromodulation are devices. There are internal and external. The ones that we use for migraine are external, meaning you hold something up to a certain nerve on your body, and in a either preventive, try to avoid attacks altogether, acute, treat when it happens, or both type of way, you will reduce the number, the frequency, the severity, the impact of attacks. Neuromodulation, and then complementary and integrative medicine, physical and occupational therapies. So a lot of important stuff in that circle there. Complementary and integrated medicine may be some things that we don't know that we don't have the same level of data because the studies are a little hard to do, like yoga, like some of the nutraceuticals. The nutraceuticals, that means vitamins, herbs, and minerals. Some of them have very strong, solid data for migraine prevention. Also phototherapies, that means certain light filtering, can be with glasses, can be with certain types of light. Scientists at Harvard have found, Dr. Rami Burstein and his team found the most comfortable wavelength of light that exists, which is a pretty green light, and found out again that, and you have Dr. DeGray there, a amazing headache expert who knows everything about vision in the eye, will tell you, but what's painful, the blue light is painful. So we need to think for each person with migraine, what pieces from each of these circles do you need in your migraine management plan? So let's talk a little bit about what are the lifestyle approaches that matter. It's not a forever list, but it's a bit of a list. What do these all have in common? Well, they have in common that we are trying to get a very regular routine, as boring as possible, as healthy as possible across some of these circadian functions that we humans do every day. Beyond humans, but everyone does it. All animals do every day. Okay, sleep. For migraine, not only do you need enough sleep, enough quality sleep, but we really want to keep you on a regular sleeping and waking schedule. It's a little boring, but as much as possible, try to stay similar to about the same time to sleep and about the same time to wake 7 days a week, if at all possible. You can cheat a little bit on your days off, but try to stay in a similar sleep wake, try to get enough. Too little or too much sleep can actually precede an attack. People find that that can be related. Eating. When it comes to diets, what we know is that low inflammation, healthy diets are always a good idea for humans. And that has to do with eating the healthy fats, trying to limit the unhealthy fats. They do seem to be helpful for migraine, but even more important on this timing. We want to have people eating on a regular basis throughout the day at regular times, and just keeping that blood sugar level steady. For a lot of people don't start with breakfast. They may not feel hungry, but it's really important to fuel up early on, thinking about a mix of proteins and veggies and fruits. And depending on what your office workplace is, or if you have a youth, a kiddo, or a teen who's in school, we are happy to write you doctor's notes that say that you must have a break to eat every 3 hours. So we don't want our teenagers to go from 6 a.m. until 1 p.m. lunch. We want to make sure they get a little healthy something there in the middle. And we will always write that doctor's note for you. We will also write that doctor's note for water. If you're in a workplace that you can't have water close by, we will write a doctor's note and say you must stay hydrated. Think of healthy hydration. Try to think about things that pull away the hydration. Try to avoid those. That's going to be the caffeinated drinks and the energy drinks. We want to stay hydrated. Any change can trigger attacks for people. So if you are used to a certain level of caffeine, you drop down quickly, you may notice headaches. So you want to do slower change. So we want to stay hydrated. We want to manage stress. We can't always control what happens to us, but we can work on how it affects us. And that's something you're going to do with a psychologist, with cognitive behavioral therapy, with mindfulness, maybe with exercise, maybe with support groups, maybe with spirituality, whatever works for you. Social support can be is very important. Whatever group is your group is important, and then education, which you're doing right now. So you're ahead of the game on that. Okay, so why do these things matter? Well, as I mentioned, we're really trying to get ourselves onto a very regular circadian cycle. One of the parts of the brain that seems to trigger migraine attacks is where a lot of these circadian cycles are regulated. And so we really want to keep things real calm and predictable for the nervous system. And so here's a little graphic of what we think might be going on. For a lot of people, it may not even be one of these risk factors, but maybe a couple of things happen. Maybe there was a lot of stress getting ready for a big work or a big performance or a big test. And then maybe on top of that, someone was premenstrual. Maybe it's a woman and she was about to have her period, and that's a vulnerable time. And then maybe she had a glass of red wine, and 1, 2, 3, and she's kind of over that threshold. But what we can do is we want to raise the threshold. That threshold for an attack can raise and lower. So by getting enough sleep and staying hydrated and exercising and moving and managing stress, we might be able to raise that threshold. So maybe at another time you can have 1, 2, 3, those kind of potential risk factors build up, and maybe they don't pass over that threshold for a trigger. What we're trying to do is bring resilience to the nervous system, bring all those healthy habits to keep the nervous system flexible, and so that we raise that threshold. These are all things you can do on your own, absolutely. But what's the behavioral part? Well, the behavioral migraine management may be that your healthcare professional talks to you about this. It may be your headache expert neurologist who talks to you about it, maybe your primary care professional, or you may find that it's helpful to have either a psychologist work with you on some of these things, let's say stress management, or another type of expert, maybe a physical therapist, maybe a coach, maybe someone, a support group friend. It can be anyone who kind of is a helper. And when it comes to integrating these lifestyle habits, these are not easy. These are not easy. It is so much easier to take a pill than to exercise 5 days a week for 30 days, 30 minutes at a certain heart rate level. It's not easy. It's asking a lot. It's asking scheduling and making the time and finding the place to go and making sure that your family is taken care of, and the cost of a gym or a location and weather. There's a lot that goes into that. So one thing that if you were to see a psychologist to work on behavioral migraine management, you might talk about SMART goals. SMART goals are when we work on any of these lifestyle habits, take any of them, improving sleep, improving diet, improving hydration, improving stress management. And we set these very specific, measurable, attainable, relevant, and time-based goals. So instead of saying something vague like, you need to work out more, we would say, well, our goal is going to be 5 days a week. 30 minutes or more, certain heart rate. But we're not going to start there. We're going to start at step one. Step one, maybe figuring out what kind of exercise is interesting to you. So maybe the first week or two is doing a little research to see what's around and what your options are. We're going to build up goals so that you succeed at each of these steps and nothing feels too insurmountable. It's not a whole mountain to climb. It's just one step at a time. If you're to work with a psychologist, physical therapist, occupational therapist, social worker, they're going to help with this kind of gradated goal setting. Okay, let's dive into the behavioral therapies. These are the behavioral therapies that have grade A evidence, meaning that there are literally hundreds of studies showing their efficacy as migraine prevention. That's going to be cognitive behavioral therapy for migraine, relaxation training, and biofeedback. And I'm going to talk a little bit about what each one is. We also have some therapies which have very solid evidence in other disease states, but are newer in being applied to migraine. And by newer, I mean a good 20 years now. So they're not that new anymore. But those are going to be the mindfulness-based therapies, mindfulness-based cognitive therapy, mindfulness-based stress reduction, acceptance and commitment therapy. All of these therapies have evidence as migraine prevention. So let me tell you a little bit about them. When we come to behavioral migraine management, everything can be combined with medications or it can be instead of medications. And a lot of times people will kind of change as they go throughout life. So say a woman is considering getting pregnant and her doctor says, these are all medications you can't take during pregnancy. That might be a time when she says, okay, I'm going to do behavioral migraine management as my primary treatment during the next X amount of months for pre-pregnancy planning, pregnancy, and postpartum breastfeeding. Or there might be a time when someone has other major health conditions. Maybe they had a heart attack or something that their doctor says, I really want you off these meds for a while. And you think, okay, I'm going to really do behavioral. There's a lot of times, though, when combining the tailored behavioral and the perfect for you medication regimen, also don't forget the neurostimulation, the physical therapy. Combining all of these gets to really the best outcomes. And here's the slide with data showing that if we look on the left, placebo, that's the blue and the green. Placebo is when someone is given a pill that is just made out of sugar. It doesn't do anything. It could be an injection that has just saline, just salt water in it. Or it could be in a behavioral trial, an intervention that doesn't have any components designed to help them change. So when we look at the placebo rates, we see in 3 different large trials, how much do patients with migraine improve? And we see some pretty good rates there for placebo, which makes us think if people believe they're doing something that's helpful, it actually was helpful. And so it's not just all in their mind. It means neurotransmitters got released. It means that muscles relaxed and heart rate was a good rate, and that oxygen increased, and all these healthy states increased with this positive belief. And I'm going to talk a little bit about ways we can actually make those things happen voluntarily in just a moment when I talk about biofeedback and relaxation therapies. And then we can see the preventive medication alone. And these studies were with our older therapies. So these studies were done more than a decade ago. And so they don't have our brand new type of therapies, but with the older traditional oral migraine preventive therapies, we see those rates of efficacy, of improvement are about similar to the behavioral therapies alone. And on the far right, we really see the best results with reducing the most attacks and improving quality of life and improving disability was when in all 3 of these studies, 2 of these are adult, 1 is pediatric, that when someone combined the medication therapy that was appropriate for the person and the behavioral therapy, we really see the biggest improvement. So for many people, that might be the best route. Behavioral therapies you don't do forever. They're often something you learn and then you kind of integrate into your life. You don't have to go forever. They're more time limited. You learn the skills. We do want you to keep practicing the skills, keep on your healthy lifestyle habits, keep on your relaxation therapies long term. but they really are something that you go and you have kind of a time investment of 8 to 12 weeks, and then you've got these skills that you bring forward. So let's talk a little bit about what actually happens with the psychologist in the room. The relaxation response is the part of the nervous system. The nervous system has two sides. It's got a relaxation, rest and digest, which means that the whole body is kind of in a calm, rejuvenating state. And the nervous system controls quite a few of the functions of survival and life that we often even don't think about. We kind of think they're automatic. So your breathing rate, your heart rate, your muscle tension, how much you're sweating, the heart rate variability, which is the kind of interval beats between beats and how much that changes, all sorts of things. You can either have the nervous system being more of a calm state or more of an activated state. The activated state, that's our sympathetic branch of our nervous system. That's the fight, flight, or freeze response. That obviously has great survival value. It's very important. It's something that we and all organisms need for survival. So we're not saying that that's a bad state of being. But what's happened is that humans have the ability to get themselves in the fight, flight, or freeze response when they're not actually in physical danger. We have, with our beautiful brains, the ability to worry about something that already happened, something that might happen in the future, may not even happen, and we can actually become quite anxious, worried, activated when there's not actually physical danger present that we need to flee from or fight or escape from. Also, the experience of pain and chronic pain will activate that sympathetic response. So the relaxation response is the calming and quieting of the nervous system. It's slowing down the heart rate, deepening, pacing, slowing the breathing rate, relaxing the muscles. When you do that, a lot of things in the body follow along. Certain neurotransmitters are released, and you don't have the amount of sweating. You don't have the goosebumps and the sweaty palms. You don't have your pupils relax. All sorts of parts of your body kind of go into more of a relaxation mode. It's a great time for your body repairing itself, digesting food, all of those kind of survival functions. So our goal is to really notice when we're in the relaxation response and when the body is more in the stress, the fight, flight, or freeze response. And when it's there, we want to do something about it. So one of the most universal ways to calm and quiet the body is starting with the breath. And this is a very simple technique you can do anytime, anywhere. Simply thinking about breathing in through your nose, holding, and breathing out through your mouth. If you do just one breath cycle, you will start to feel some relaxation in your body. Not only will you feel it, but your heart rate will slow down. You'll get more oxygen into your system, your muscles will relax, and it's very good for your nervous system. So let me show you, if you were to learn and practice with a psychologist or do this on your own. I've got some exercises on my website, which is just my name, dawnbuse.com. You can find exercises all over the internet and all sorts of free apps in the iTunes store and the Google Play Store. But let's just do one round of square breathing so you can see what this would feel like. I like to start with one hand on the chest and one hand on the stomach. The reason I like to do that is, first, I'd like for you to just notice which is moving. As we go throughout our day, especially if we are feeling worried, stressed, anxious, we tend to breathe high and shallow, and we will see the shoulders rising and falling. So ultimately, our goal is for the hand where you're on your chest to stay more stable and really start to breathe into the belly. So the diaphragm, we call it diaphragmatic breathing because the diaphragm is a muscle that's along the bottom of the lungs, and when it pulls so that the lungs expand, and then they fill up like a balloon. So our goal is that you're going to breathe in through your nose. I'm going to count to 4. You're going to hold it while I count to 4. And exhale out through your mouth, and then we're going to start again. If this feels too slow, you can speed it up. If it feels too fast, you can slow it down. Ultimately, with some practice, our goal is for your breathing pace to slow down and become slower. So sit back and relax. One hand on the chest, one on the stomach, in through your nose. 2, 3, 4. Hold. 2, 3, 4. Exhale. 2, 3, 4. In. 2, 3, 4. Hold. 2, 3, 4. Exhale. 2, 3, 4. That's a simple paced diaphragmatic breathing. There are quite a few different paces that you can choose from. You can explore a lot of ways to learn this, but this is often the basis of starting any relaxation, mindfulness, yoga, or calming practice. In fact, also it's been a staple of Lamaze for childbirth, has been around for 100 years now, based on breathing. We know that this is a really calming, soothing, and excellent pain management technique that you can do anytime, anywhere. So that's diaphragmatic breathing. Progressive muscle relaxation. Some people will find that they like to be a little bit more physical. And so progressive muscle relaxation has actually been around for more than 100 years. Well, actually just coming up on 100 years, actually, since it was first published in the literature in 1938. So we're almost getting there. And here, what we want to do is notice what muscle tension feels like and achieve deep muscle relaxation. And if I were just to say, okay, relax your muscles, you'd sit back and say, okay, how do I do that? But what we like to do in PMR is progressively choose a body part to tense and hold. So if you want to take your arm, I'm doing my right arm, I'm clenching a fist with my right arm, I'm also making a bicep, and we're going to hold that for about 20 seconds. Now, if you do this on your own, you can do longer, you can do shorter. And now let's go ahead and let that arm down, set it on your lap, your chair, your table, whatever in front of you. And notice how lovely that feels to get this warmth and heaviness to come into the muscles. Now, it should feel a little bit like kind of a wet noodle there. And with PMR, we'll start with the muscles at the top of the head. We'll scrunch the forehead, the cheeks, the eyelids, the jaw, the neck, the shoulders, all the way down the body. Of course, skipping anything you don't want to clench. Sometimes if someone either has a headache at the moment or migraine attack coming on, they'll say, oh, I don't want to clench anything around here. That's fine. But the idea is once you relax, circulation really kind of moves into that muscle. Your whole body's left feeling warm, heavy, and relaxed. That's a great, quick relaxation method that's been around for a long time. Guided visual imagery is also a very popular and effective approach. This is something we do in relaxation training. And here we just go to a beautiful place in your mind. I often do a warming sort of suggestion because we want to improve circulation. So it might be a beautiful beach, it might be out in the desert, maybe it's southern Utah, hiking amongst gorgeous arches on a warm summer day. And we take you there with all of your sights. You imagine what you see, what you hear, what you feel. Really get yourself into the situation of somewhere that's warm, safe, and relaxing. So you're creating your own movie, your own image, and guiding yourself into a beautiful relaxation. If you're working with a psychologist, maybe a physical therapist, occupational therapist, social worker, licensed professional counselor, they can guide you through a session. You can also find sessions like this all over the internet, again on apps, so many popular apps. Some are low cost with a monthly or annual fee. Some are free, and you can make them up yourself. So what happens when you're doing this guiding warm imagery is your body moves again from that activation, that sympathetic activation, into a calm, relaxed, parasympathetic state, the relaxed state that is so good for your nervous system. These are all things that we recommend you do on a preventive, regular basis, whether you have headache that day or not, ideally when you don't, so that you train your nervous system, one, to notice when it's activated, but then two, when it is activated, to relax. So these are preventive behavioral migraine management therapies. Now, biofeedback is a really interesting approach where we layer on top of our relaxation therapies that we just talked about, breathing, imagery, PMR. Now we're going to actually look at your physiology. So literally, we're just feeding back biologic information. We're letting you know what your heart rate is right now, what's your breathing rate right now, what's your muscle tension right now. And you can see in this image that this young woman has some sensors for muscle tension in her forehead. She has a blood volume pulse measure on her finger. We can do finger temperature. When you are more activated, more distressed, you're going to have colder hands, feet, nose, because the blood has come to the core of the body. When you're more relaxed, circulation goes everywhere. So we're going to get warmer hands, but that also means we're getting more blood to the brain, and that's always our goal. So biofeedback, literally you are hooked up to equipment, or perhaps it's more on a phone or some wearable technology where it's measuring another sense. A phone can measure heart rate by bouncing the light from the camera off of arteries in your forehead and measure your heart rate, your respiratory rate. There's other sensors that go on an ear, a smartwatch, that you can also start getting some biofeedback, noticing when your body's activated, and then doing that practice to calm and relax. So that's biofeedback. Here is what biofeedback looks like if you're doing it in the office with a healthcare professional like a psychologist. So this is some equipment that I have called thought technology equipment. You can see that there's a color word, blood volume pressure in red, BVP. You see a red line. You see respiration in blue. You see a nice blue line. You see finger temperature in yellow. And here, this is a 2-minute session. And our goal is for the patient to raise their finger temperature, calm their heart rate, lower muscle tension, and have nice steady breathing. And we watch that right on the screen, just like this. Sometimes, though, you might even see it look more like a video game. Some of the not only in-office sessions, as well as some things that you might try with apps and wearables, might look like more like a video game. So the more you relax, the higher your balloon floats, or maybe you swim across a river, or some other type of interaction. There are also virtual reality biofeedback applications. There was a wonderful study done at the University of Washington by Dr. Amy Cunero with virtual reality biofeedback. So a lot of really neat things coming down the pike. And this is something that if you think, seeing a psychologist, you think, oh, talk therapy laying on a couch. Here you can see there's nothing on the couch here, that this is very interactive, looks more like a video game, is really kind of a fun interaction. Okay. Now let's switch from biofeedback to the mindfulness-based therapies. We've all heard about mindfulness. What is mindfulness? Mindfulness is the practice of noticing without judging. Mindfulness-based therapies bring mindfulness meditation and mindfulness practices into a learning approach, so that you have different skills that you practice. And also, if you work with a psychologist or therapist, they will personalize it to you, to your life. Mindfulness-based stress reduction is more of a pure mindful meditation and stress reduction program. Programs usually anywhere between 6 or 8 to 12 weeks. They may be in group formats, they may be individual formats. Mindfulness-based cognitive therapy brings some of the cognitive behavioral, especially cognitive ways that we think about things into the mix. So mindfulness-based cognitive therapy, we still do the mindfulness practices and focus, but we also test a little bit, how do we view the world? How do we think about the world? And are there ways that we could change our thinking to get better outcomes, both feeling better as well as the world kind of going better for us? So those are the mindfulness-based programs. There are specific mindfulness-based therapies which have been modified for migraine, personalized for migraine, that we've tested for migraine. But chances are, wherever you're living around the country, around the world, you may not find a migraine program, and that's okay. You will learn great skills if you join an MBCT or MBSR program or group. All right, cognitive behavioral therapy. You have probably heard about cognitive behavioral therapy. It's been around for decades. It does two things. Cognitive, how do we think about the world? What ways of thinking are kind of getting us into trouble, either with our feelings and our emotions or with the way life is going? And behavioral. Behavioral has a lot to do with those lifestyle habits I mentioned. The exercise, the stress management, the healthy eating and hydration, the sleep. Those are the behavioral parts. So let me show you a couple ideas. If we were to think about, you were to come into my office, what are we going to do? We're going to talk about kind of surviving and thriving with migraine. How's it affecting your world, your family, your profession, your academic career, your well-being? We're going to figure out how migraine is having these challenges for you, how it's becoming disabling, and what kinds of things kind of strategies can we kind of use to work through those. Sometimes therapy goes beyond the person with migraine. It might become a family therapy. Its spouse might come. It might become, if we've got a younger person with migraine, it might be a parent involved, or vice versa. If we've got parents with migraine, we might bring in the teens because, as I mentioned, migraine affects the whole family system, the whole family dynamic. And sometimes we need to work with the whole family to really get the dynamic back to a better balance where everyone's feeling better and working well together again. I think this is a great quote. I love this quote by John Kabat-Zinn, who really developed mindfulness-based stress reduction for low back pain and introduced it really in the kind of medical science world in the 90s. He says, we can't stop the waves from coming, but we can learn how to surf. So we have a lot of strategies. On the pharmacologic side, the neuromodulation side, maybe we're going to try to stop the waves from coming, and even the migraine prevention. But what do we do when those attacks still come? How do we manage them? How do we keep living our lives the way that we want to? How do we make things work? Reclaiming your identity. When living with a chronic illness or disease, it is common that people start to feel like they lose themselves. They lose other aspects of their life. I used to do this. I used to do this at work. I used to be this person socially. I used to be this to my friends. And now, the world and the universe can shrink and you can become just a patient, just a person with migraine. And that's one focus that's really important in cognitive behavioral therapy, is really assessing what are your values, what has changed, what can't you do, but what can you do, and really starting to recreate life again and getting back to a place that brings you the fulfillment that you want to have, the relationships that you want to have, knowing that there may be some real limitations and things you can't do or you can't do the same, but what can you do? How can you kind of reclaim and remake a life that feels fulfilling, if that is something that migraine has started to take from you? Also, I'd like to remind you to be kind and gentle and patient with yourself. There is a really high amount of self-stigma among people with migraine. In our Overcome study of 60,000 people with migraine, we found that a large percentage of people really put a lot of blame on themselves, as well as felt the blame from others, felt the stigma, felt the discounting from others. So I want you to kind of take a moment back, step back, and take a moment and remind yourself of who you are and all the good that you put out in the world and all the things that you do, even if you are not doing things in the same way that you used to, or being productive in the same way that felt right to you, or contributing in the same way you used to. What do you do now? And be softer and more gentle with yourself, because people are pretty hard on themselves. So that is something that we'd work on in CBT. We might also work on assertiveness in the workplace, with family members, with extended family members. We would work on self-confidence, self-efficacy is what we call it, that you have the power to get things done and to make things happen. So those are all things that we work on in cognitive behavioral therapy. We also work on the ways that we view the world. So some common things that we all do as humans is we may have black or white thinking. You know, it's either this or this. And sometimes that gets us into trouble because that's not always the case. We might catastrophize. So we might quickly snowball from the first thing that happened to this horrible event. And we might need to kind of pull back and say, well, what's the real size of this problem? Is it really catastrophic, or is it really minor, or is it somewhere in the middle? So changing and altering the way we view things, that's the cognitive piece of cognitive behavioral therapy. So I want to remind everyone, if you live with migraine, if you don't live with migraine, whatever it is that is affecting you, please ask for and accept help. And I mean this on all levels. Talk to a doctor. They are the key to getting the prescription treatments. Consider talking to a mental health professional. And I'm going to go through a list of who they are, because there's a bunch of us with different names and different titles and different degrees. So I'm going to talk about that in a minute. Ask for and accept help from friends and neighbors and family. You know, people always say, what can I do? How can I help? And we always say, oh, thanks, I'm fine. Don't say that. Think of something that the next person who asks, that offers help, can do for you. Not only does it help lighten your load, but it makes the other person feel good. People who are offering to help really often want to help. Give them something to do. You may even have a young child who says, Mommy or Daddy, what can I do? And you may give them a little job for when you have a migraine attack. You might say, well, it feels good if I have a cold washcloth and some cold water. And I also like it if you sit quietly, but you touch my hand. Something. Give everyone a job and a way to help you. And that not only improves your situation, but it kind of helps the other people around you feel that they're part of the situation and caring for you, which they want to do. These are all the kinds of things that we would work on in therapy. So I'm a psychologist who specializes in migraine. If you came in my office, I wouldn't really divide up those 5 things. I'd probably hook you up to some biofeedback. We would talk about how migraine's affecting you. We might talk about your family. I'd write some doctor's notes to your boss or your school saying you need these accommodations, water with you, a break to eat, turn off the overhead lights, give you a desk light, let you wear therapeutic glasses, whatever it is, we get those accommodations made. We do some CBT, some biofeedback, some mindfulness practice. We kind of do all of it. But if you've been referred for behavioral migraine management, or you're going to self-refer, you say, okay, this makes sense to me. I can see how this can benefit me. How can you find a referral? I'm so sorry to say, sometimes this is the hardest part of the process. Now, sometimes you may get referred by a healthcare professional who actually has someone to refer you to. There may be a psychologist, mental health provider, PT, OT, social worker in the practice, which is amazing when there is, or in the larger hospital or clinic or community setting. So that's a place to start. You may want to check with your insurance provider and see who they have on their panel so that that's someone who'd be covered for you. But that can vary so much depending on what your insurance is, where you live, your geography. In the bigger cities, it's usually a little easier to find referrals, and it gets much harder in more rural areas, can be really much harder. And that may be where we think about telehealth or online options or apps. I do have some referral websites I'm going to show you in just a moment. It's going to be the next slide. But okay, this part gets a little tricky. Who am I referring to? There's a whole little group of us that you might be referred to. So if you go look at the bottom bullet here, provider types, a psychologist. A psychologist is going to have a PhD or maybe a PsyD, so Doctor of Psychology, or an EDD, a Doctorate of Education. They will be licensed, and you need to actually be licensed and have that doctoral degree to legally call yourself a psychologist in the US. So that's a doctoral level title. You may also have a licensed counselor. A licensed professional counselor could be an LPC, marriage and family counselor, MFC, MFCC. Might have some different terms depending on the state where you live, because all of these things are licensed by state. So the terms can vary, the names can vary state by state. You may have a social worker. A social worker could be licensed clinical social worker, LICSW, LCSW, maybe a master's in social work, MSW. So I slid forward. Any of those designations may be someone who's going to be your mental health provider. And I don't even know if we should say mental health, behavioral health provider. Again, we're not necessarily treating depression or anxiety, although that comes with the territory. It is a comorbidity of migraine, and it's incredibly common. But we're really talking about these behavioral treatments. If we're thinking about biofeedback can come from a behavioral provider, like everyone I just mentioned, can also come from an occupational therapist or a physical therapist. And then every once in a while, you might have a psychiatrist in the mix. Now, a psychiatrist is a medical doctor, an MD or a DO. Those are the two licenses in the US that could be a medical doctor, and they are licensed to prescribe medication. So you might get referred to a psychiatrist to help with medication management of depression or anxiety or another type of psychological condition. So I realize that's a little confusing. I'm going to make it a little bit more confusing, but I'm going to try to clear things up a little bit. So say that you don't have a provider right there at your hospital or your clinic. Who are you looking for? Well, what you can do is search on one of the search websites. I'm going to show you in just a minute some examples of some that I'm aware of that you can find a provider. You're going to need to look for a keyword. Your keyword could be biofeedback or pain or health psychology, cognitive behavioral therapy, could be behavioral medicine, the mindfulness-based cognitive therapy, or the mindfulness-based stress reduction. Kind of anything you saw me present a slide on today that had a keyword, you're going to look for those keywords when you search. So let me show you here, for example. Here's a list of places where I often recommend people search. You will generally not find migraine or headache as a specialty, but you might. So start there, then move on to pain, then move on to behavioral medicine. So let's say you search any of these. The American Psychological Association, Psychology Today has a nice search website. You would type in some of these keywords and see if anyone comes up as listing those keywords in their area of specialty. And then if so, you will need to see if they are a provider who is accepted by your insurance, and if not, what their cost is. And sometimes you can find good programs for very low or a sliding fee scale if you go to college or university counseling centers or community service centers. So it's all variable depending on your individual situation, and this part can take a little bit of work. But I hope some of those keys are helpful for doing that search. This is info for whoever that provider ends up being. Once you get to that psychologist, they are going to use these codes for billing. And this is very important because it used to be decades ago that if you saw a psychologist, it was thought that you were going for a psychological diagnosis, like a depression or anxiety. Here we're going for a health code, a health reason, migraine or chronic pain. And that's why there are some specific CPT codes. That's what your provider is going to use for billing, that don't have a psychological diagnosis, they have a health diagnosis. So when I write my bill, we have one of these codes, which are created for psychologists or other mental health providers who are doing behavioral management of a medical condition. So that's something just to make sure that they know and look on your bill and make sure that it matches 9615 and then one of these endings, depending on, is it the first visit? Is it a follow-up visit? Is it shorter? Is it group? Is it individual? As I mentioned, there's a whole world of emerging technology, which is really great because access to these therapies and access to providers remains a constant challenge. There are all sorts of things to explore. There are quite a few diaries that have let you track migraine and other symptoms, which you can share with healthcare professionals. They can also help you if you have any signs that you may be able to use for predicting attacks, your own personal triggers, your own personal risks. There are some biofeedback options now available via smartphone apps or wearable technology. There are some online options for programs such as cognitive behavioral therapy via app, via text. There are a lot of free mindfulness, meditation, and guided visual imagery and relaxation programs out there on websites and on apps, as well as some lower cost, some digital therapeutics, and then telehealth. Mental health providers are licensed by state. So even for telehealth, you generally need to be within that state. But if you're in Utah and you're down in southern Utah or you're up in northern Utah, you can find a provider in Salt Lake City to do telehealth because she or he's within your state. Same thing with the larger states, California, Texas, New York. You may be quite a ways across the state, but you stay in the state. It gets a little trickier when you don't have someone in the state, although there were some provisions lifted during the pandemic that may or may not still be in place. And if you go to the Veterans Administration Hospital, which has terrific behavioral health care, then you can get care at whichever hospital is your local hospital, and you don't have to worry about the state by state regulations. A couple books that kind of old school. I still love books. These are 3 different workbooks that are really reasonably low priced and really go through a lot of what I as a psychologist teach in my office. So if you wanted to just check out these books from your local library or buy them, they're very reasonably priced. These have some great workbook interaction information and checklists that you can try and kind of get yourself started on some of the, especially cognitive behavioral therapy, as well as some of the relaxation therapies. 3 different books that I really like. And you may want to explore on your own and find more that are out there that you really like. So I know I shared a lot. And what I think I want you to take away at the end is we have so many options for you that have scientific backing that you can choose from. And so if you're working with a doctor, that doctor can help you figure out from those circles I showed what combination of, be it medication, neurostimulation, nutraceuticals, the behavioral therapies, and the lifestyle habits, what's going to work best for you. For anyone at any time, whether you currently have a doctor treating your migraine or not, you will benefit from those healthy lifestyle habits. Those are good for everybody. They are first line recommendations in the US, in Europe, and everywhere else. We all agree Those are really valuable for calming and kind of regulating the nervous system for someone with migraine. And you can self-refer yourself to any of the behavioral or psychological therapies that I talked about today. But it's great to get your healthcare professional involved because they are going to be able to work it into your full plan and really personalize that plan for you. And all of our migraine specific medications are by prescription. So we really do want to make sure if you live with migraine that you are talking to your doctor. Of the 40 million Americans who have migraine, about half of them have talked to a doctor. So we've still got 20 million of you to go. That's why I'm making this plea. Make sure to mention it to your doctor. For 80% of people who do talk to their doctor, it's going to be a primary care professional, and that's just fine. You could start with your family doctor. You could start with your pediatrician if you're younger. You could start with you tell your OBGYN. You can start with whoever you see as your regular point of contact to get started, and they may choose to refer you on to a neurologist or a headache expert, or you may do that on your own. But if you can get your healthcare professional kind of as the quarterback, they can start to help you choose from these different scientifically validated therapies that we have to offer to really create the optimal personalized treatment plan that works best for you.